Hi everyone, Bridget here at the AAFE Training Center. We are doing some lifting threads on my patient. So we usually do these about once a year. She got them, I think, 2 other times. So the past 2 years, she's gotten lifting threads in her lower face and her neck. She's really concerned with her lower face, like specifically her oral commissure marionette region. We've come a long way. She does all kinds of treatments to help. We've done sculpture, we've done lower face tox consistently, we've done filler, we've honestly tried everything. And she really liked the result of the lifting threads and the sculpture combined. So I did her sculpture about 12-ish weeks ago, and then we decided to do lifting threads today. So I'm going to walk you through this procedure and how to do it. First thing, you're going to mark the patient up. You always want to make sure you're entering like over the masseter. You don't want to be back by the parotid or anything like that. And you want to be far enough back to where when she's smiling, it's not going to be pushing the end of the thread out. So first, I numb the pilot hole with lidocaine and epinephrine. The epinephrine cuts down on the bleeding at the pilot site, so it's just easy and causes less swelling and bruising. So I start there, and then I go in with my regular 2% or 1% lidocaine to make tracks for my cannula. So I'm using the VSoft Arte 1 threads. These are the 18 by 100, and they're what's called L-shaped. So L-shaped is basically when the cannula that's holding the thread on there is half blunt and half sharp. So fully blunt, I think, is very difficult to get through the tissue. It's going to be like a really big version of a blunted cannula that you would use for filler. I just think it's hard to use, so I usually, kind of go for the L-shaped. The fully sharp ones I also tend to not go for. Just personally, now that I've had a lot of experience with threads, I don't like the sharp ones. Causes a lot more trauma, but they're great when you're first learning. So if you need to, and if one of your patients is one of your first cases of lifting threads, then definitely use the sharp. It will just overall help you glide through the tissue a lot easier than the L-shaped or the fully blunt. But I usually vouch for the Arte ones. They're probably my most used thread. So I kind of do the same thing on the neck. I am entering anterior to the SCM, so I don't want to be over the SCM, or every single time she would like turn her head or lift her head from bed, that muscle would contract and then the thread would again start to work its way out. So I just want to make sure that I'm going in a place that she's not going to have complications. In the neck, obviously you want to be very careful. Your parotid artery is down there, and obviously, we're not trying to hit that. You'd have to be really deep to hit that, but that is one concern in this area, is that there can be a lot of bruising just because there's so many major vessels in the neck. So I'm going to be doing the same thing, making my tracks with my lidocaine, going in with my thread, and then I always make sure to kind of go past where I want to end my thread, because when I'm pulling out, it's going to come out with me. So I always kind of go past where I want to pull from, and then kind of release the thread from there. I pull a little bit on the ends of the thread once I'm done, just to give her, obviously an immediate result. And then also I want to lift the tissue, but I don't want to pull so much of the thread out that I'm leaving a lot of those barbs out. So I want to leave as many barbs as I can in the skin, because that's what's going to actually lift the tissue through over time. But I do want to pull it enough so that it engages and does end up lifting the tissue and isn't just kind of floating around in there. So then I always make sure to kind of rub out any kinks. We kind of call this puckering. It's very, very normal. If your patient ever gets this, it's not a big deal. It's not a complication. Yes, is it kind of annoying? But if you can't get one out, it's probably because of swelling. So you'll see I'm kind of struggling with one there, but it ended up popping for me. Sometimes they won't, and if you have any issues, just have your patient apply heat to the area and it will break down the thread quicker. I hope this helps.